All right, folks, I'd like to call the meeting, what was supposed to be the last meeting of the Joint Subcommittee to study the Commonwealth's response to the pandemic to order. First, we need to call the roll.
Delegate Webert, Delegate Gardner,
She was here, wasn't she?
Just stepped out.
Yeah.
Delegate Shin, Delegate Sickles, Delegate Sullivan, Senator Favola, Senator Suderline, Senator Hashmi, Chris Jones,
Here.
Jennifer Siciliano, Caitlin Deal, Martha Mugler, Heather Jones, Jacqueline Grice, Lisa Lucas Burke,
Here.
Secretary Merrick, Secretary Gadara, Secretary Cummings, Secretary Kelly, Secretary Cole,
Here by proxy.
Secretary Haid, Delegate Munden King, Senator Surville.
Here. And Jillian, obviously, we don't have a quorum. Okay, so ladies and gentlemen, committee, and also for the folks out there, we just checked with a couple members. We're not going to get the quorum today. Delegate Sickles is en route, but we had, I think, 3 people who RSVP'd who said they're going to be here today, apparently changed their mind. So we're not going to get the quorum, which means we can't take any votes, but Amigo is still going to present to us what the findings were of the 3 subcommittees. We'll see if anybody up here has any negative feedback on any of the recommendations from those subcommittees. And then if nobody has any negative feedback about anything, we'll sort of figure out what to do next. We might be able to call another meeting maybe like the day or 2 before session or something like that to validate the recommendations. But obviously these came out of subcommittee, I think every subcommittee unanimously, if I'm not mistaken. So I don't think there's a lot of dissension about these recommendations. Is that right, Amigo?
Yeah, so since they were virtual meetings, there were no votes, but they were the consensus. I think there's some other things that I can say about the education subcommittee that I'll explain when I get to those. But yeah, they were basically the consensus recommendations from the subcommittee.
Great. So why don't we at least get that stuff done today? And Amigo, why don't you? I think you prepared a PowerPoint, right?
Yes, well, we call them slide decks these days.
Okay, slide deck. You have a slide deck.
So they're for the proprietary. All right. So just to get us to where we are now, we hired the Tidal Basin Government Consulting as the consultant. They did what's called an after-action report, which basically developed the COVID timeline and reviewed the actions that were taken by the Commonwealth. And from their work, which consisted of surveys, a public comment survey, as well as interviews, they developed a series of observations, and from those observations, they provided recommendations. After that, my DLS, along with some of the different members, developed a series of policy options to bring some of those recommendations to life, and that's what the subcommittees looked at. So very briefly, there were a total of 58 recommendations. If you sort of look at it sort of as an inverted pyramid, we started with the final report at the October meeting that had the 58 recommendations. You all took a subcommittee approach where those recommendations were split up based on subject matter area of the 3 subcommittees. The subcommittees all met in November. They were virtual meetings, and I think Subcommittee 2 had a long meeting. I think a couple of people, when they blanked off the screen, actually took a nap. It was about a 2-hour meeting, but they went through each of the recommendations and each of the policy options that were provided. So what you have in your blue packets would be, we call it a subcommittee report, and what that report does is it goes through and for each recommendation gives you what the consensus was of the subcommittee at that meeting. And from those, the second document is probably the most important one, which was going to be sort of our roadmap for today, was going to be the action items. Those are the things that were being put forward for review by the full joint subcommittee, just in terms of action going forward. As I said, I'm going to go through the three subcommittees. I do want to add that for the Education Subcommittee, Subcommittee 3, there were several items that the subcommittee members wanted to get additional information on, and we had the person representing the Secretary of Education's office was very gracious, and she got that information back out to the joint subcommittee. So the subcommittee consensus at the meeting was for further discussion. Since that time, I spoke with the subcommittee chair. So some of the recommendations that you will see will actually be the subcommittee chair's recommendations. So I don't want to make you think that they were the subcommittee consensus, but those recommendations were based on the information the additional information that was provided by the Secretary's office, and that's in your blue package too, behind Subcommittee 3. Just going through here is the Subcommittee 1, Government and Regulatory Systems. It had 9 members on it. They had to look at a total of 21 recommendations, and from those recommendations, there were 35 policy options. And the consensus actions were 6 legislative actions, 4 letters, and what those letters are, they're letters that will go to either secretaries or agencies, asking them to look at the observation and the recommendation and to report back. They're particularly in situations where the subcommittee just didn't think that they had enough information, and they really wanted to hear from the people that are in the trenches to get their take on things. And then there was one instance where budget language is being recommended. So here are the, I'm just going to very quickly walk you through what the 6 legislative actions are. The first one would be to have legislation requesting the Secretary of Public Safety and Homeland Security to convene a work group to study the feasibility of establishing a centralized continuity of operations framework for state agencies. The after-action report found that that the pandemic exposed significant challenges in maintaining operations across state agencies. So this was what came out of that. This would be a Section 1 bill asking the Secretary to study that. Or it could also be a joint a study resolution. So it's so when we say legislation, it can be a resolution or a Section 1 bill. Of course, resolutions don't have to go to the governor's office to be signed, but bills do. The next one is we'll be asking VDEM, and I have said I've said VDEM so many times. My wife thought I was cussing. I said VDEM, because you will hear VDEM a lot, but for the people out, I'm not cussing. It would be to ask VDEM with the assistance of the Secure and Resilient Commonwealth Panel to study the state's reliance on grants for core emergency management functions. One of the things that came out of the after-action report was that there was a lot of reliance on federal grants, and the subcommittee thought that that's something that we could have looked at to see if we can do things better. The third legislative recommendation would be to convene a work group, to have VDEM convene a work group to put in place or to recommend a comprehensive legal and regulatory framework which would take effect in the event of an emergency. The after-action report found that the absence of a pre-established legal and regulatory framework, such as swiftly adopting regulations and things of that nature, really slowed things down in terms of reaction. The next, the fourth legislative recommendation would be for DPS, which is the Division of Purchases and Supply, which is a division within General Services that deals with the purchase of goods and services, not the building part, but to have them in conjunction with VDEM to design what's called a dynamic stockpile strategy. There's some more information included in your action item package to sort of explain what that involves. The next legislation would be expanding the current exemption that's in the Public Procurement Act. I think what it currently says is it provides for an exemption for the purchase of PPE. This would expand that to include suppliers of certain supplies, as well as any tests that need to be provided. the sixth and final legislative recommendation from the subcommittee would be, again, VDM. I think I'm going to apply for whatever job you all have to advertise for to do this, in conjunction with VITA, to establish a work group to look at, to review technology service gaps that exist during emergencies. One of the themes in the after-action report was that the spottiness of broadband and other technology issues made it difficult for state agencies and local governments to respond. The next set of things are the letters. These are letters that would, as I said, would go to the agency or the secretariat that has subject matter jurisdiction, to ask them to look at some of the observations and report back with any findings and recommendations. So the first one would be to the Commonwealth Broadband Chief Advisor and Broadband Advisory Council, and that would be to get them to look at some of the digital infrastructure issues that were raised. All of these will be asking for these bodies or these individuals to report back to the General Assembly by November 1st of 2025. The second one would be to the Secretary of Administration, and that has to do with looking at the possibility of a statewide telework policy that would apply to all state agencies. I think there was some discussion in the subcommittee about, we have the legislative branch and the executive branch and the judicial branch. Trying to find a one-size-fits-all might be difficult. So the idea was to have that looked at to see if there's something that could be done to make things different or maybe easier to deal with just the whole telework issue. The next one, there were a series of several items that were being that were pulled out and were going to be put in a letter to go to the Judicial Council. I did want to say that there is a Scrivener's error. See, when you after you've been in state government for 15 years, mistakes become Scrivener's errors. So I can call it a Scrivener's error. Item 3.A, which is the first item listed, should not be going to the Judicial Council. That is covered by the legislation that we have under number 3 for the legislative action. That one's going to VDM. That one is not going to the Judicial Council. So that's a correction that has to be made. That was a mistake that I made. So there are a series of issues, and if you look at your action item, you can see what those issues are. Several observations as well as recommendations that we wanted the council to look at. The last letter would go to the Freedom of Information Advisory Council, and of course that dealt with the meetings and having meetings during the pandemic and how things can be done better. The last item would be budget language, and this language would ask DGS in conjunction with VITA to study the development of a centralized resource management system. Any questions about the subcommittee consensus recommendations?
So that was subcommittee number 1, right?
Yes.
This is my subcommittee. Probably went through that for what, hour and a half, 2 hours to get to those conclusions. And most of those are going to be Section 1 bills, not actual changes to code in terms of the bills. But a lot of basically almost everything we looked at just seemed to be a lot of stuff that was going to require a lot more thought and insight in order to get at more specific policy proposals or changes. And a lot of it was kind of management related, sort of government management related kind of stuff. So if we end up adopting those, I think we'll see a lot of reports probably towards the end of next year with some possible action, statutes to adopt and things like that. But anybody have any questions for Amigo about, or concerns, I guess, about what he just articulated for the recommendations from subcommittee number 1, which is government and regulatory systems? Nope. All right, Amigo, let's go on to number 2.
All right, for number 2, they had 8 members. Delegate Sickles was the chair of that subcommittee.
And Amigo, if I'm not mistaken, this one had the largest number of
Yeah,
things to work through,
it
right?
actually, it had 31 recommendations and 91 policy options. And I can tell you that I don't have that many policy options when I'm at home. I have one or two, but I will say that the subcommittee, they soldiered through it, and that was, it was a long meeting, but they looked at each and every recommendation. So if there is an award for interim work, then that subcommittee should get it. So out of those, again, looking at the upside, the inverted pyramid, out of all of those policy options, these were the consensus actions. There were 6 legislative actions recommended, one letter requesting review, and that letter, of course, is going to VDEM. There were 2 instances of budget language, and what this subcommittee did, it was a little different than the other subcommittees. There were several things that the subcommittee thought were just common sense or things that would just be regular good government. So they developed a list of 19 best practice recommendations, and they would be basically not requiring action, but something that could be provided to the agencies. A lot of them may already be doing it, but that was what the subcommittee wanted. And all those should be they should be listed in the report, and we were going to develop a separate document that would list those best practice things, and look to maybe disseminate those. So just going through the 6 pieces of legislation, the first one, VDEM in cooperation with BDHDS, would look at asking them to develop a standardized guidelines for mental health support during extended incident. And as a part of that, there was really some focus on getting a definition of what an extended incident is, because what may be an extended incident to one person may not be to another. The second piece would be asking VDEM to develop a training program on NIMS and the ICS system and the role of the EOC. And this would be something that agency heads would be required to attend within 6 months of being appointed, and also looking at having additional training at different intervals. One of the things that came out of the AAR report was that in their interviews and in the surveys that they got back, it did not appear that everyone knew what these 3 things were and how they related to them. The third item would direct each state agency to develop a document for the agency that outlined the incident command system and the role of the of VEST in the event of a declared emergency. The next 3 legislative items were having the Chief Information Officer and VEDA in cooperation with VDEM to develop an emergency resource management system. And that's basically, it would be a system for tracking roles, responsibilities, and resource allocation during emergencies. The fifth item would be for VDEM and the Department of Health to study the existing emergency management regions and the local health districts and regions and recommend some more beneficial alignments. One of the things that came out of the report was I think there are 7 emergency management regions, and there are 35 local districts and 5 regional ones, if I think I got that right. And they wanted the 2 bodies to look to see if the after action report seemed to say that them not aligning a little better may have slowed down resources. So the idea of the subcommittee is to have those 2 bodies to look at and see if could be some realignment to make things a little easier. And did I get that right? Okay. Yeah. The last legislative item would be to have VDEM to offer health and safety training to volunteer organizations that are involved in the VEST system, and also to put together a health monitoring system for all volunteers who are working or who are incorporated in that VEST system during times of emergency. In terms of there is the one letter, and that's on page 2 of your action item. It's basically, there were a lot of, that letter covers 6 observations and 7 recommendations. Again, to have VDM to look at those items and report back by November 5th of 2025. The budget language, there were 2 instances. The first one would be to have VDM. This could also, it doesn't have to be a budget item. It could be legislation. It would be to have VDM and health to study the development and implementation of a data collecting framework for healthcare and other external partners. One of the things that came out of the after action report was that there was some of the private sector and public sector that wasn't. Some of it was not interoperable. I think I get a special prize for being able to say that word. But that's what that would cover. And the last item would be funding for VDM to establish an educational outreach campaign. One of the things that came out of the after action report was that there was a need to try to get more volunteers involved in it, with the emphasis on younger. And I think that what we found at the subcommittee meeting was younger didn't mean teenagers. It just meant younger than 60 or 70. So just having an outreach campaign to get more volunteers involved, and that's what Subcommittee 2 did. If there are any questions about their
I had a question for you, amigo.
Yes.
So I know one of the things that happened, at least in Northern Virginia during the pandemic, was that because several of our local health districts up there operate independent of the state healthcare system, the vaccine rules and policies were the deadlines and it was all very different than whatever the state was announcing, created a lot of confusion. Was there any recommendation out of this subcommittee about whether or not during emergencies there ought to be a uniform statewide policy instead of allowing sort of the independent health districts to do their own thing, or was that not part of their recommendation?
Yeah, I think the closest thing that would come to that would be the one asking to look at the how the regions lined up. I don't know if anyone else on the committee. I don't think that it's specific.
Delegate Jones, or former Delegate Jones, whatever.
Yes, and we didn't discuss that directly, but I think that's certainly something that should be considered in case of an emergency, to have a platform that is going to be consistent across the Commonwealth. So something we should consider.
Yeah, I just know Fairfax County runs its own systems. You had 17% of the state that was prioritizing things differently, announcing things differently.
Right.
Prince William has now become independent since then. I think Arlington's independent. And so you had one set of rules being announced on a statewide basis, and half of Northern Virginia was under one set of rules and half was under another set. And it was kind of confusing when that was all going on.
I would agree.
That was one of the things I was hoping they'd look at. But okay, I'll talk to Sickles when he gets here about it. Yeah, he is. Says he is. All right. Any other questions for Migo about sub 2? Nope. Okay.
All right. Yeah. So Subcommittee 3 had 7 members. They also met on the 19th of November. They had a total of 6 recommendations to look at, and 13 policy options that were attendant to them. When it says subcommittee consensus, as I mentioned earlier, there were several items but the subcommittee said that they wanted more discussion on, and in particular, there were questions that were asked of the Secretary of Education's representative, and when those answers came back in, Subcommittee Chair Munden King made some recommendations. So I've tried to note that in your packet. It will say Subcommittee Chairman's recommendation, so that you know that the subcommittee hasn't seen it yet. So they were basically 4 legislative actions that are being recommended, and 1 for budget language. The first one would be to amend Section 22.1 of the Code of Virginia, there's already a model memorandum of understanding that can be used by schools when it comes to providing options for students to receive counseling from school counselors. This would add to that memorandum a provision that would allow for providing options for students to receive counseling from school counselors via telehealth. The second one would be one of the things that was provided by the Secretary of Education's office was information on a mental health first aid training program that had been established, and I think it's there's an adult mental health first aid training. It's an 8-hour course, and it's basically looking at identifying how to respond to signs of mental illness and substance abuse. There's also a youth mental health first aid training, and this is for adults who react or who regularly interact with youth and young people. And the focus there is on mental health, crisis management, and substance abuse when it comes to youth. And I think that the numbers that were provided, that in a spring training, they had 20 school nurses that had gone through the training. And in a more recent training, I think summer training, there were 240 school nurses. So the recommendation of the subcommittee chair would be to codify that program, to put it in the code. The next legislative item would be asking the Department of Health to develop guidelines and information relating to virtual learning, and you see the items that were specific. Again, this is a subcommittee chair recommendation. It didn't come from the subcommittee consensus discussions, and the recommendation was made after reviewing the information that had come from the Secretary's office. The next item is another Scrivener's error. The correct code site should be 22.1-279.8, and it would basically amend the Code of Virginia to require schools to include in their annual safety audits it's information about their comprehensive plan for school closures due to public health emergencies. The last item is a budget item, and again, this is from the subcommittee chair. That item would be to support funding of the Individualized Education Program Training, or IEP, implementation. Now, what the subcommittee chair said was that there is a joint commission to study elementary and secondary education funding. And I think in a more recent meeting, she said that JLOC had indicated that it would take $8.7 million to fully fund Level 1 services for the IEP programs. So that basically is what came out of Subcommittee 3.
Yeah, they had the smallest number of recommendations, whatever to look at, I guess, or suggestions to look at. Anybody got any questions for Migo about education sub, those recommendations? Nope. Doesn't look like we got any questions.
No.
Or concerns or problems? Okay. Yeah, Senator Hashmi.
I know in our full committee, we had raised the question about why there weren't any recommendations for higher education, and we simply just did not get any responses to the survey for higher education. But I think we do need to keep in mind that there probably needs to be something that comes out of this committee focused on higher education as well.
Got any ideas? I know we had one of our civilian reps was higher ed, I believe. Is that right, Amigo? And that person resigned, right?
Yeah, that person is not here. I think that person may have resigned. Yes.
Yeah, so there was supposed to be a person on here representing higher ed.
Right.
I think they didn't
I think
very much.
just as a basic recommendation would be that our institution should have a policy or plan in place like we're asking our K-12 to do.
In the event of a
In the event of emergency, yeah.
Okay.
Yeah, I think what the consultant said in response to your question, Senator Hashmi, was that they reached out to Chev, and through Chev, they were trying to get to the different higher ed entities, and they didn't get a response.
Mr. Chairman?
Sure, Mr. Powell, go ahead.
You said the last one related to IEPs was one of the chair's recommendations.
Yes, that was not a part of the subcommittee consensus at the meeting.
Was there discussion at the subcommittee level as to
Mr. Powell.
the IEP challenges?
Yeah, Mr. Powell, by the way, you got to turn your mic on so people in the internet world can hear what you're saying.
I was just curious if there was discussion.
It's still not on. You got to go green. There you go.
I was just curious as to the discussion. So there was no discussion on that topic at the subcommittee level, and there was no discussion in the report as to how the pandemic exacerbated IEP challenges.
Mr. Wade would have to answer that question because I'm not a member of the subcommittee and the chairman is on an airplane right now.
There was no discussion at the subcommittee. I think that one of the recommendations, I would have to look to see, referred to it, but the subcommittee did not include a discussion about, as you're saying, some of the difficulties with IEP and getting funding for it.
Thank you.
Yeah.
Mr. Chairman?
Yeah, Mr. Jones, or
As far as
Delegate
the
Jones.
Senator's comments, I think maybe the chairman of the two money committees ought to write whoever is head of the college presidents and suggest they provide a response as to why they chose not to participate.
Well, I think a letter from the chairman of the Senate Education and Health Committee as a member of this commission to them
Yeah,
might
who-
be
yeah,
a good way
yeah,
to do that.
yeah. I just think you need to. Yeah,
I'd be happy to co-sign it with her, yeah.
yeah. I just think that would be probably we get someone's attention.
Yeah.
Yes, ma'am.
Some good advice there from somebody who knows what he's doing. Any other thoughts or feedback? Any other concerns? So, so folks, before we still take public comment, by the way, but I mean, I talked to Migo before the meeting about sort of where we stand on this, and he thinks that we can still send out these letters, have these bills drafted, ready for introduction, subject to the exemption from bill limits in the Senate. I don't know about the House, though, but on our side, these don't count against our drafting limits or our filing limits if they're validated by the committee. But in any event, to officially be adopted, we have to take a vote, which we can't do right now. But I think if we had another meeting like a day or two before session, when you got 140 members in the building, we probably could get quorum a lot easier than we could right now. So I think you might get another poll from us for a meeting on the Monday or Tuesday before session. We could probably knock this out in about 30 minutes or something like that to validate the recommendations. Plus, I'm not sure whether Senator Hashmi's in my letter will get a response by then, but in any event, I think that's probably the plan, just so we can validate the final output of this joint study commission before we put it to bed. Mr. Wade, you look like you want to say something.
Well, just to say that we have made the request as pre-filed legislation, so it would be just a matter of drafting the legislation, and the difference would be, of course, if you all did not vote for it, then it wouldn't be introduced. If you did, we would be able to say that it was endorsed by the joint subcommittee. So that's so everything is set for them to be pre-filed.
Right. So it's all queued up and ready to go, but getting it endorsed, I think, would be potentially a useful final step. Is there any other feedback or thoughts? No. Okay. Well, we still have to take public comment. Oh, you have on here assignment of patrons for legislation. Do we have to?
Yeah, that was wishful thinking.
Yeah. There else. I mean, the three legislators here are going to be carrying about 20 bills between us. So I think we need to. I'll I'll talk with Delegate Munden King, my co-chair, and she and I will come up with a list. Might be a little harder in the House though, because you guys got those 15 bill limits you got to deal with. Yeah.
And I'm not sure about it.
Yeah. So, but we'll deal with that separately. So that brings us to number 4, public comment. So, Jillian. Okay. Yeah. How many, did we have a sign up? No sign up. How many of y'all raise your hand if you're going to talk? 1, 2, 3. Anybody else? Okay, 3 people. Okay. Well, given the fact we only have 3 people and not 30, how about we fire up the timer for 5 minutes each?
Oh, Lord.
All right. Well, they've been taking the time to come. We only got 3 people today, so come on up. You don't have to take all 5. We'd appreciate if you didn't.
Thank you. I'm Dr. Sheila Fury from the Virginia Medical Freedom Alliance. I hope that each of you have had the time to read the December 2nd COVID pandemic released by the Congressional Committee for Lessons Learned about COVID-19. The first and foremost lesson learned was the confirmation that this virus was engineered by the United States, paid for by the United States through gain-of-function research to establish a pathogen and then leaked into the environment. Second, the citizens of the United States and the world were betrayed by international public institutions, the government, and businesses. The very institutions whose sole purpose was to protect the public chose to follow their own self-serving interests, the interests of Big Pharma, and other lucrative organizations, NIH, CDC, the WHO, and others who promoted measures and policies unsupported by scientific knowledge and, moreover, overtly harmful. Out of this, I think it is incredibly important that we recognize that change must occur. It is our recommendations that we have to establish policy which will prevent bioweapon development and deployment. All gain-of-function research is particularly important to stop. I think it's also important for this committee to know that there is a biosafety lab level 4 across the street. I also think it is important for this committee to understand that the next pandemic is underway in the highly pathogenic avian influenza, and gain of research function is currently going on, and it just happens to coincide with areas of outbreak of avian flu. I also recommend that we do not follow any orders or recommendations of any foreign or domestic organization which has a financial interest in spreading the disease or its countermeasures. It is clear that members who benefited from this pandemic reaped huge benefits, financial benefits, because of the patents that they held on vaccines. The same is true for the so-called highly pathogenic avian flu. We must make sure that those who lied about the material facts related to the origin of the virus and the status of countermeasures come to justice. The decision makers on the matters of public policy should be noticed of their liability in conjunction with the liability under Nuremberg Code of 1947. This pandemic response committee should only be devoted to preventing the occurrence and development and the release of pathogens, and should let go of all other measures, and that any countermeasure any mandatory so-called vaccine would not be allowed, and that it would be voluntary, and voluntary with all information made beforehand. True informed consent, not a blank piece of paper. We need to call for a publicly independent voluntary committee of collaborative healthcare experts to provide quarterly updates to the public on the treatment protocols for those injured by the COVID-19 shots and those with long COVID. Additionally, we need to work with the Attorney General's office to advocate for and obtain compensation for the pharmaceutical companies for all those harmed by the COVID-19 shots.
Okay, you wrap it up. I gave you 5 minutes this time.
In conclusion, I hope that each of you are up to date on your boosters, and that should be, by Virginia Department of Health standards, 9 or 10 shots. Thank you.
Great. Thank you. Okay, who's up next? Shelley Arnoldi, 34th District. Good to see you.
Good to see you too. Mine is shorter. Thought it was only going to be 2 minutes, and I have something I'd like to hand out to all of you. Not a professional, not in an organization, but it's references that I think you all should look into since you're part of this subcommittee. They're just health organizations and advice and movies. So Fairfax County is the largest school division. He mentioned it. We have over 1 million people, 200,000 K through 12, or 200 K through 12 schools, and 280,000 students. And in August of 2021, Fairfax apparently joined 60 other school divisions to opt into a COVID testing program called VISTA, which is short for Virginia School Testing, Screening and Testing for Assurance. And the program was in partnership between Virginia Department of Health and the Department of Education. The VISTA program was copied directly from a report called Risk Assessment and Testing Protocols for Reducing SARS-CoV-2 Transmission in K-12 Schools, funded by the Rockefeller Foundation, Duke, and Johns Hopkins, and it was completed in October of 2020. In August of 2021, Fairfax decided to enforce VISTA and produced its K-12 COVID-19 testing program playbook, which was almost identical to the Rockefeller-funded report produced a year prior. In fall of 2021, my daughters were in 9th and 11th grades and in just completed volleyball season, where they were required to play every game with masks, and they chose sometimes to wear 2 masks. This has since been proven to do more harm than good, and I have references I'll give to you. There's 170 studies to go over masks, the harms of masks, and how they do not prevent transmission of respiratory viruses. Schools were closed for more than a year prior to that, and when they opened, our kids were forced to wear face coverings for nearly a year. This cannot happen again. In November of 2021, swim season was about to start, and Fairfax County decided to mandate all athletes either get a vaccine or submit weekly testing. At that time, it was 20 months after the pandemic, and 0 school-age kids, 5 to 19, had died, and very few healthy adults had died or even been injured in the hospital from COVID-19. The symptoms to that date, were between nothing and a mild flu. Basically, the recovery was 100%. So CDC's own website admitted the vaccine did not prevent transmission, so the testing had absolutely no positive effect. In fact, it appeared to be financially driven, as the program earned the school district billions of dollars from federal government COVID funding. The justification for the mandatory testing came from the survey and a study performed by VCU. In it, they said that there would be a 50% reduction in COVID cases if the testing program took place. This estimate was based on, 50% was literally a guess, written in the documents. It said reduction in school infections by 50% is based on conversations with infectious disease modelers. A value of 50% was selected as plausible. There was no data behind it. The other statement that caused the testing, they said 56% of parents would be more comfortable if the kids were tested or vaccinated. Well, that 56% was actually 16 people. It was a subset of questions where 29 people were asked, would you be more comfortable if your kids were going to school with kids who had been tested? And 16 of those people said yes. So those are the two justifications for a mandatory vaccine or testing policy, which was completely unconstitutional. So I'm going to provide these resources because you guys can just do the QR codes. I'll tell you what they are. 170 mask studies. You can research them yourselves. The Great Barrington Declaration, which has, I think, almost 100,000 physicians signed on to policies, future policies. There's a media library and a documentary from 2 different sources. And the Committee Oversight Accountability Pandemic Report is on the bottom. That's the big one that was just done that she was referencing. The 500-page report and summary, which frankly is all you need. I don't know how much you paid for this last report. I would hope you stop funding any future reports because they're not necessary. And I hope whatever your future plans are, there's a $ attached to it, and you can let us all know what you're paying for these future follow-on actions that people frankly don't want. All right, that's all I have.
Great. Thank you, Mr. Arnoldi. Thank you for all your attendance. I think you've made almost every one of our meetings if you haven't made all of them. So thanks. I think you've made almost all of our meetings, I think, if not all of them. So thank you for coming. All right, last up.
Well, my name's Philip Andrew Hamilton. I'm coming from Charlottesville, Virginia, and I'm also a fellow supporter of the Virginia Medical Freedom Alliance that Dr. Sheila Fury founded. And I come here today, as a Virginian, as a parent, and as an advocate as well. But, we saw 4 years ago what happened, not to just the Commonwealth of Virginia, but to our nation. We saw schools shutting down. We saw churches and, other places closed, but, strip clubs and liquor stores that stayed open. But what I would like to see this committee do is what can we do? Let's do a study on keeping schools open. What is it, if there were a future pandemic, what measures can be taken to maintain in-person learning for our children? As we saw that the rate of suicide went up when schools were closed. There were kids who couldn't socialize with their fellow classmates, with their friends, and rates of depression went up drastically. And I'd like to see a study on how school closures affected the mental health of our children and what can we do to make it more difficult rather than easier, which I saw in these past recommendations that were presented earlier today, to close our schools. So I think it needs to be a priority to keep our schools open, not to amend the Virginia Code to make it easier to close them. So that is, I think, should be a top priority. And I think we should do a study, at least 1,000 plus participants, take these school-age students who were, in school between the years of 2020 and 2022, and see what the study was on their mental health, and from students in Commonwealth of Virginia, and let's have that presented before the Senate in 2025 before we move forward with any of these recommendations. So I hope you take that to heart. Thank you.
Thank you for staying within 3 minutes. Okay, I think that's it for public comment. Ladies and gentlemen of the committee, I think we'll probably poll you for either Monday or Tuesday before sessions. We can take one final vote on the recommendations. I would think we could bang it out in 20 minutes at this point, so we have validation and can wrap this up. But I appreciate you all making the time to be here on a Friday afternoon today and following through on your promise to appear consistent with your RSVP, unlike 3 other people who didn't come today, or else we wouldn't have had a meeting. So, but thanks for coming, and hope you all enjoy your weekend, and we'll be adjourned.
The Senate of Virginia, Richmond, Virginia.